like our body's always sensing what's going in and on in our body. That's redundant. Our brain is always sensing what's going on in our body. And if there's a joint that's stuck, our brain inhibits or weakens the muscles in the area. So if we get that joint to move better, then the strength comes back. And that's been shown in the upper back with the muscles that pull our shoulders back. And we see it every day in the hips and the SI joint. We also use massage to work out knots. A lot of times it's kind of sore in through there, and that can inhibit the muscles. So working that out helps to bring the strength back. We also do isometrics to connect the brain, to make a better connection between the brain and the muscle, to give the brain a chance to relearn how to activate the muscle fibers. So an isometric is holding. So for example, we might have a person on their side and then just gently push down here and hold it for like 10 or 20 seconds. And then the brain gets better at activating that muscle and again, more strength. And then exercises that isolate that muscle, and then some functional exercises that bring in more muscles and mimic what we do during the day so that our brain learns how to do it more automatically. So we test the hip strength by having the person on their side, and we do like a straight leg raise test. And then we do a clamshell test. And like I said, we pretty much always find that the side where there's pain, it's weaker. And here's Maggie's doing a mobilization of the SI joint. So she's pushing down through the sacrum and then asking the person to hold here while she pushes gently, and the muscles help to loosen up that joint. And then we use massage to work out knots. And here's the isometric re-education of the muscles. And then this would be an exercise that we would give for homework for the person to do at home on their own. So the way we think of it is that we gain it in the office and then you keep it by doing these at home. And this muscle, like this would be good for anybody to do. This muscle is really important along the sides, and it tends to get weak. And then we would use functional exercises like a squat, working on the technique of keeping the knees lined up as the person does it. So now Dr. Curtis is going to talk about what we do with the ankle.
So there are a bunch of different bones in the foot and ankle, and like Jim mentioned, we want to make sure that they stay in alignment when we're walking and doing different activities to prevent the foot from rolling in, which puts the pressure on the knee. So to treat the ankle, we want to check to see how the bones in the foot are moving. So we start in a non-weight bearing position, so that would be sitting or laying down, and assess how all the different bones of the foot move on each other. And we also want to look at it in standing to see if anything changes in the standing position, because that's more functional. The ankle motion can also be limited by tightness on the back of the leg. So calf tightness can make it so that you can't get that 10 degrees that you need to roll over your foot. So we sometimes use massage to help work out the knots in the calf. And then for the whole lower leg, we do that contraction, the gentle contraction, where you just hold a position to try and retrain the muscles on the hip, the knee, and the foot all together. We do stretching exercises, which we give people to do at home a couple of times every day. And then we put it all together with functional exercises as well. So here's an example of the non-weight bearing ankle mobilization. So we, in sitting, check how every bone moves on the bones around it, and all of them should move a little bit. If we find that there's a bone that's stuck and not moving well, we put some pressure on that bone and try and get it to move better so that we have the motion that we need. And then this is the same thing, but when we do it in standing. So here the person is standing, and I'm holding the foot in a neutral position, and then they slowly put weight on and off their foot to try and loosen up the bones to get the motion. So here's a calf massage. So we're working on the back of the lower leg to see if there's any tightness, and then when we find tightness, we massage it to try and loosen up the muscles. In this position, the person is sitting, and we do a couple different diagonals to try and engage the foot muscles, the knee muscles, and the hip muscles. And this helps to strengthen and reconnect the brain with the foot and the ankle so that the muscles in the arch can be strong enough to support the weight when you're walking. And then stretching exercises. So this complements the massage and the joint mobilizations that we do and helps to maintain the new mobility gained in the treatment sessions. So here we're just stretching the back of the leg and the calf, and there are a couple different ways that that can be done. And then putting it all together. So the functional exercise, we could use a squat or walking. Here for the squat, if we're focusing on the foot, we really want to make sure that the foot stays straight and that the feet aren't turned out and that the knees are coming right over the middle of the foot and not going in like those pictures earlier on. And then we do some gait training. So we watch people walk and make sure that when they put it all together, they're rolling more off the second and third toe and not off of the first toe, which can cause the knee to turn in. So we do a lot of practice with that to make sure that we can break the old habit and make a new habit so that we don't increase the knee pain.
So we don't ignore the knee either. There are things that we do at the knee to reduce the inflammation and reduce the pain, localized pain there. So we gently mobilize the kneecap. A lot of times the kneecap is tight, or one side of it is tight, and it's pulling the kneecap to the side. So we loosen that up. We restore the correct flexibility, including rotation. So sometimes people's knee won't go all the way straight, or it won't bend very much. So we work on getting normal straightening and bending. But also, if the foot has been turned up for a long time, it can be kind of stuck there and not turn in very well. We work on the rotation to make sure that the motion is available. And we use massage also at the knee to work out any soreness or knots or anything like that. And then we use the isometric neuromuscular re-education, like you saw in the previous picture, to reconnect the brain with the muscles so the muscles activate properly. And then we use exercises and isolating exercises as well as functional exercises. So here's some mobilization of the kneecap. And here's working on the flexibility at the knee, turning it in. We also combine that with manual resistance, which gets it, so we'll have somebody we'll take them to where they're limited, and we'll ask them to hold it and gently push, hold it for like 10 seconds. And then by doing that, we're able to get a little bit more, and we do that 2 or 3 times. More massage. This is that area called pes anserine, which tends to get sore. And then this would be, like before and after. Now this is me. I'm just doing that. But this is John's knee, and this is when he came in. with the foot turned out. And then this is the end of that one appointment. And now it's a lot straighter. So, at our clinic, we've taken a bunch of classes, and that is where we get the approach that we use that's comprehensive in being both isolating as well as functioning, manual therapy, using our hands to get things to loosen up, using our hands to get things stronger. And there's 3 of us. Gina is in Florida right now, she's not here today. Yeah, so we were ready for John.
You can't get up the scooters.
So maybe we'll have, so John's knee is a lot better,
Yes.
so we're gonna try to show what it used to be like. Maybe come forward a little
Get a little
bit
bit
more.
here. Okay.
Yeah.
And
So-
kind of go down like that a little bit.
Yeah,
Yeah.
and then your knee in.
Yeah, that's right, yeah.
So now do a little squat. Yeah, let the knee come in a little bit more as you squat. Yeah, so that's what it looked like when we started. And then come back up. And now make your knee straight. Yep. Also, he couldn't get it all the way straight. And by the way, John came in for something else, which turned out being really minor. His right hip was a little sore. We fixed that pretty quickly, but watching him walk, I was like, what about your left knee? And he said, oh yeah, the doctor told me I got a knee replacement pretty soon. So I said, well, let's work on that. So we worked on it, and it's been, what, 5 appointments maybe?
Yeah, 5 appointments, yeah.
And
That's right. Yeah.
it's doing a lot better. Is it feeling better?
I'll give you a quick history. This whole thing started when I was in Navy OCS in 1967, where we used to jump off things and he'll land in the sand. That's when I originally injured this knee. The other one, I always landed on my left knee. Ever since then, not since then, but it went away for years. It was treated by then, but once I got into my late 60s, then it started to hurt a lot. And they tried an injection, and that worked a little bit. The Synvisc 1 injection, they did that. That's the hyaluronic acid injection. And that was okay for a while, but the last one didn't work very well at all. And they said, well, it looks like it's time for a knee replacement. And I said, oh, I don't think so. And so here's the answer. So that's what happened. So I started coming in, and I was doing the exercises at home, and then you added the insoles.
Mm-hmm.
That's right.
Yeah.
Yeah, I have, once I put the insoles in, things were going well when I was using doing the exercises at home. But once I added some insoles, some high arch insoles, which kind of tended to make my foot kind of angle out a little bit, just literally sitting there like that removed it all entirely. It was like, huh? And so, I go to the JCC, and I walk an hour. So I do about 3.5 miles in an hour. And it used to be, I was doing the 3.5 miles that way. Now I just walk. It's like night and day. So, anyway,
5 appointments.
5 appointments. That's right.
So does anybody, based on what I've said, actually,
Let's
can
do
we
that
just do
one.
one? Yeah, can you do one more good squat? Like,
Oh, you mean like this?
yeah.
Oh,
Now it's
sure.
all lined up.
Yeah. I can
And we
work
probably
that.
still have a little more work to do on your ankle and stuff, but
Yeah.
I would estimate like 2 more appointments.
Yeah.
Good. He's also really diligent about doing his exercises. Yes.
So I'm just, I'm sorry, go ahead.
I've been through the physical therapy, and, the insurance is only gonna pay for so many sessions, and then, so a big question for me is, so then what? I'm in the gym here every day. I'm on the elliptical, I'm doing some things with weights. How do I know if I'm doing the right thing? Is there too much? If my knee starts to ache, should I stop? Can you talk a little bit about what you do to try to maintain?
Yeah, good question. Before I have John sit down, are there any questions for John?